Hi, this is Dr. Daria Hamrah, facial cosmetic surgeon, Washington, D.C. Today, we're going to talk about upper facial rejuvenation, in particular, brow lift and blepharoplasty. Quickly, brow lift is exactly what it says, lifting the brow or shaping the brow. Blepharoplasty means eyelid surgery, upper eyelid and lower eyelid, puffy eye bags, hooding of the eyelids. The reason why I combine these two procedures in this video, because you kind of can't separate them. It gets very confusing if you separate them. They go hand in hand, and an experienced surgeon always has to evaluate and address the brow together with the eyelids. If you ever go to anyone, to any doctor or surgeon that does not address both, just beware and make sure you ask the question. It's one of the most commonly misdiagnosed procedures by even some experienced surgeons. The reason for that is that, the position of the brow is kind of like based on preference. Some people like high arch brows, some people like flat brows. Scientifically, an aesthetic brow is when the arch, which is the lateral peak, the peaks of the sides here that, most women know what I'm talking about, has to be higher than the mid portion of the brow. It has to be slightly higher. Okay, if it's the same level, you kind of have like a flat brow, and if that peak is lower than the center, you kind of have a sad puppy look, or kind of like a sleepy look, which doesn't make someone look attractive. And those are subliminal messages that we get when we look at someone. We capture the emotion of that person when we look at their eyes. Your eyes, guys, are the entrance to your soul. It's an old wise saying, and for a good reason. Whenever you look at someone, the first thing you do is you look them in the eyes. At least you should. The eyebrows and the eyelids will signal whether you're tired, whether you're happy, whether you're angry, whether you're rested. All of those emotions transfer to your eyes. So the brow position and the eyelids basically tell people how you feel and how you are. And there's not a person that has come to me, the first thing they said is like, Doc, my friend always tells me why I'm upset. And I tell them I'm not upset. It's just, my eyebrows are kind of too low. Or I have a teacher last week, she came to me and says like, my students think I'm upset at them or I'm always angry. I'm not. And I looked at her, and sure enough, the mid portion of her eyebrows were down. So those signal certain emotions that you as a person might not feel, but the eyebrow position and the eyelid position might signal to whoever's looking at you. And that's why we're addressing these issues. The other aspect is why I address them together is because your eyebrow skin and your eyelid skin are connected. So the position of the eyebrow changes how much fullness you have of underneath it, which is essentially your upper eyelid. So they're connected. So I have patients come to me and they say, yes, I did a consultation before and I was told I need a blepharoplasty, which is excess skin of my upper eyelid removed. And I look at them and I see their brow is too low. And that's actually, their complaint is like, people think I'm kind of tired and angry. And when I look at them, it's because their eyebrow is actually low. So a single test you can do is you pull up the forehead skin or the eyebrow and into the right position. And if you then don't have excess skin on your upper eyelid, you don't need an eyelid surgery. You do not need a blepharoplasty. You just need a brow lift. So the problem is if you have a blepharoplasty in this particular case, later on if you actually, let's say you come to me and I say you actually needed a brow lift, sometimes I might not be able to do the brow lift because if I now lift the brow, you don't have enough skin to be able to close your eyelid. Okay? So it's very important that that's diagnosed properly. So whenever I do eyelid surgery, the first thing I do, I make sure the eyebrows are in the right position, and if they're not, I will educate my patient. They might need just a brow lift, or they might need both. I put the brow in the right position. If they still have excess skin, I also do a blepharoplasty. In very minor cases, I can just tighten the skin with the CO2 laser instead of removing a strip of skin. And that's what a blepharoplasty really is removing a strip of skin and eyelid muscle, in some very rare cases, the fat, which we tend not to do anymore, because it just gives the skeletonized look of the eye, which makes you kind of look actually older, especially as you age. So we're more conservative in removing fat on the upper eyelids. And by removing the skin and the fat, you eliminate the hooding with the proper eyebrow position, makes you look youthful, awake, happy, and just makes you look like you feel. As to the lower eyelid, most commonly the complaint is the puffy eye bags, which is basically the fat that is protruding through the little ligament that is keeping the fat back. So there's two cases where in some people anatomically, since they were born that is weak, it's just genetic, and you might have to have it done in your 20s or 30s, and that's because you have this puffy eye bags which casts a shadow under your eyelids. And by removing that, that solves the problem. Or due to aging. When you get older, these ligaments kind of stretch and become loose, and the fat pops up. And we just remove the fat through inside the eyelid. So no cuts are to be made outside the eyelid. We are getting more and more conservative by cutting underneath the lower eyelid. Even worse, we don't want to remove any skin. A lot of surgeons, older techniques was that removing the skin on the lower eyelid to make it smoother. The problem with that is the skin kind of stretches, and when the cheek pulls on it, you could get like lower lid retraction, and that's a very bad thing, which just causes dry eyes and a lot of other problems. So make sure you go to a surgeon that is very experienced and does a lot of these, because anyone that does a lot of these understands these problems and is able to choose the right technique. So today, if there is some wrinkling on the lower eyelids or excess skin, in my practice, I use the laser. I can just shrink and tighten the skin. I have a lot of videos on my Instagram, on my website, where I show how it actually shrinks the skin. So if you're interested, you can watch those. And with that, also, it resurfaces and gets rid of the wrinkles beautifully without any cuts or any surgeries. The only cut that's made is through inside the eyelid if there is fat to be removed. So again, just to recap, brow lift is repositioning the brow. Blepharoplasty, upper lower eyelid surgery, you could do either with laser. By the way, all my cuts around the eyelids are actually done with the laser, so it doesn't actually bleed. So less bleeding, no bruising, faster recovery. As opposed to some people, they use a knife to cut. It's kind of like old school. I used to do it. It's a lot of bleeding. It just prolongs the surgical time, prolongs the recovery due to advanced bruising and swelling. So now with the laser, my surgical time is literally cut in half, and the recovery is like maybe 3 days or so. So very important, again, not just the techniques you use, but also the tools you use. Is always a combination of both to get the best results. And of course, knowledge of facial aging and anatomy is key. So understand that not every plastic surgeon actually is trained in eyelid surgery. You really have to be a facial surgeon or trained in cosmetic surgery, have extra training. And eyelids are a very sensitive area, it's very important not only to the way it looks, but also to your vision. And you want to avoid those types of complications. So make sure you ask your doctor the right question. Hope this video helped to kind of point out the differences between the two and how they are connected and related to each other so that you don't run into any problem, okay? I hope you enjoyed this video. Thank you very much for watching. This is Dr. Daria Hamrah, facial cosmetic surgeon, Washington, D.C.